Lymphoma is the same that I told before. WBC composed of neutrophils, lymphocyte, and the eosinophils, basophil like cells. So lymphoma is a cancer of the lymphocytes. So lymphocytes, if you heard, now in the COVID era, antibody, these antibodies are produced by the lymphocytes. There are two types, B and T. We don't go in details, but roughly it tells it's a antibody producing cells. So what happens in our system, these lymphocytes imparts the immunity to all our body through the lymphatic system. It is present everywhere of the body. It's a very good system that is developed from head to toe. Everywhere there are lymph nodes except brain. Everywhere there are lymph nodes that gives the local immunity in the neck, in the chest, in the abdomen, in the legs, in the thighs, everywhere. So what these cells do, usually they identify the any infection of that part. If there is toe infection, there is enlargement of the groin area lymph node, means they are identifying their the organisms and try to kill them. So that is the function of the lymphocytes. So what happen in lymphoma, there is uncontrolled growth of these lymphocytes. There is not a uncontrolled growth only, but abnormal growth also, because these are not a normal cells. These are the cancerous cells that are growing without reason. If you see, if any infection happens, you that I told at the tip of any toe, then there is enlargement in groin area. So this is the normal physiological response to the any infection, because they have to fight that infection, so that they are increasing. In lymphoma there is uncontrolled, means there is nothing like that happening in the body, though they are increasing. And if we see them, these are all abnormal also. So mostly when you see a lymphoma, what you will see, there is swelling in the neck, axilla, groin area. Okay, then there is fever, weight loss, excessive sweating. These are the most common symptoms if you see in the lymphoma.
Right, right.
Yeah, and then after you see this, you order some baseline blood tests like CBC, LFT, creatinine, all those tests. You need to do the biopsy of that lymph node. Okay, the biopsy is a simple procedure where we insert the true cut needle and take a part of that lymph node. Sometimes we have to remove the total lymph node, sometimes only core of that lymph node. After doing this lymph node biopsy, we need to find out what are the areas where it is spread. It can be done by PET CT or CT. And after doing all this test and the bone lymph node biopsy, we can able to find out what type of the lymphoma it is, because there are basically two types of lymphoma, Hodgkin's and non-Hodgkin's. The treatment is very different. It's like east and west, so it's very necessary to exactly diagnose a type of lymphoma, so that treatment we can able to give them at a proper time, as fast as possible, and the exact treatment as well. So treatment consists of mainly, now with the advent of the many medication, the treatment mostly chemotherapy or immunotherapy, or combination of both, depending upon the type of the lymphoma. So in chemotherapy is a therapy that kills the cancerous cells, their metabolism, and they identify and kills those cells. While the in immunotherapy is a way ahead of chemotherapy, in the sense these identify the proteins produced by the tumor cells, so they can with the help of these proteins they can target the specific tumor cells, because every cells in our body produces the proteins are the building blocks of every function in our body. So the tumor cell should have the specific proteins for their growth. So this immunotherapy target such proteins. The one of the example is rituximab, which we give for the CD20 precursor. So it target the CD20 that is overexpressed in the lymphoma. And the third is once we achieve the response, or if the disease relapse, then the third option is a transplant in such patient. Um, Mostly the autologous transplant in the lymphoma, when we will see in details in subsequent questions. But the transplant is also one of the third option for the lymphoma. Coming to the myeloma,
Yes, doctor.
myeloma is a cancer of the plasma cells. Plasma cells is also a part of the WBC count, amounting for 1 to 2% of whole the WBC differential counts. Usually they never appear in the blood. They always be there in the bone marrow. So what happens, and the plasma cells are the also one part where it function to generate the antibody formation in our body. So what happens in the myeloma, these plasma cells mostly produced from our bone marrow cells. So when this happens, plasma cell leukemia, plasma multiple myeloma, sorry, not leukemia. In multiple myeloma, when this have the abnormal growth, they can cause a severe body pain, generalized body pain, because they produce the proteins. These proteins are difficult to pass through the urine, so they clog the our renal tubule system in the kidney, leading rise to the renal failure.
Okay.
And the other things, what I told, once they start proliferating, they can cause anemia. And because there are some substances they secrete that can give rise to the hypercalcemia. So mainly this patient present with the extreme pain, not able to move the limbs, anemia, dehydration, and in the confused state when we see them. And the most common problem is this one of the most common reason they contact the physicians or the oncologist or hematologist is they are not able to pass the urine also. And some on evaluation found to have this anemia and other features suggestive of the multiple myeloma. Then come the next part, how we'll diagnose it. So once we do this, we need to stage the myeloma, and we have to do the urine test, serum test to see what types of the protein is present in the multiple myeloma. So if we identify the type of proteins, and it has to be confirmed with the bone marrow test. If you do the bone marrow test, the picture will be very much clear. The bone marrow will shows the abnormal aggregates of the plasma cells once you see them, so it can be diagnosed. And after doing this, we need to do PET CT to stage what stage it is, as well as there are the various criteria to stage the multiple myeloma. And we need to do the specific cytogenetic and fish studies also to categorize them as a standard risk or the high risk multiple myeloma. Coming to the treatment part, multiple myeloma mainly consists of the we need to give a combination of the medication uh, composed of steroids, then proteasome inhibitors, and the immunomodulating agents. So after we give these cycles and achieving the complete remission, the treatment of myeloma consists of the mainly combination of the medicines, combination of steroids, proteasome inhibitors, and the third is immunomodulating agents like lenalidomide or thalidomide. After giving this combination for ranging from 4 to 6 cycles, we need to assess the response. If the patient is young, less than 60 years old, young means less than 60 years old, and having a complete response post chemotherapy. Then post chemotherapy, the next step is a bone marrow transplant, means stem cell transplantation. It is a autologous transplantation where we remove his stem cells by machine, apheresis machine, and we give a high dose chemotherapy and to destroy all the cancer cells, myeloma cells in his body. And after destroying those, we infuse the normal stem cells that we have taken from the patient. So it usually takes 2 to 3 weeks. So after completion of chemotherapy and the patient is responded well, this is the standard of care. Every myeloma patient, young age, is better to undergo transplant after achieving the complete remission. This is the treatment for myeloma.